Hi there. Welcome to the California Initiative for Health Equity and Action's webinar on economic supports for low-income families in California in the time of COVID and beyond. 2/3 of Americans say the federal government has not done enough to ease economic hardships brought on by the coronavirus pandemic, according to the latest PBS NewsHour NPR Marist poll. With a number of coronavirus relief programs set to expire at the end of the year, 40% of Americans say they or someone in their household has lost a job or income due to the coronavirus. The federal response has fallen short, and California is making important efforts to help those who are left out of the federal response, including independent contractors and other self-employed individuals, immigrant workers and mixed status families, and some low-wage workers. Our briefing today will highlight evidence and policies focused on economic support for low-income families in California during COVID-19 and beyond, including the Earned Income Tax Credit and paid family leave. We're really grateful for the sponsorship of Blue Shield of California Foundation for this event, and our co-sponsor, the Office of Assemblymember Buffy Wicks. It's my pleasure to introduce our co-sponsor, Assemblymember Wicks. She represents the 15th district in the California State Assembly, and Assemblymember Wicks focuses on housing, expanding the social safety net, protecting consumers' privacy, and championing rights of women and working families. Governor Newsom signed 8 of her bills in her first year of office and 7 of her bills into law this year during the pandemic. She chairs the Assembly Select Committee on Youth Mental Health and serves on the Banking, Finance, Budget, Privacy and Consumer Protection, Public Safety and Rules Committees. A lifelong community organizer, Assemblymember Wicks previously served on both of President Barack Obama's campaigns and worked for him while in the White House. Thank you so much, Assemblymember Wicks, for giving us opening remarks today.
Thanks, Hector, for having me. Thanks for everyone for joining today. A special shout out to the California Initiative for Health, Equity and Action, UC Berkeley, of course, I think the best university in the state of California, which is in my district, Blue Shield of California Foundation, and the IWPR. So I'm very excited to be here with all of you today and do some opening remarks. And, I've spent a lot of my career working on public policy issues that impact working families. And obviously, I think where we're at now is incredibly unique. And I get people asking me all the time, when are we going to go back to normal? And what I say to them is, I don't want to go back to normal. Normal wasn't working for so many people to begin with. And I think what this crisis has shown us is shined a spotlight on the fact that a lot of our public policies that we have to help working families have failed or don't exist, and you look at the indicators, and it was in September, 1.1 million people left the workforce because of COVID. 80% of them were women. This crisis is disproportionately impacting women of color in particular. There's a racial equity lens that we have to look at all of these issues with. And we have some real challenges. And I agree with the Hector's remarks around the people's sentiment that the federal government has failed us. We have to do more for our working families. You look at the bill that's being negotiated right now, the relief package, paid leave is not even included in that. And that's going to expire on December 31st, and that's going to impact, thousands of people's lives right when we need it most. It's not like things are getting better in terms of COVID, they're getting worse, and they will get better. I do have hope that they will. The vaccine's on its way, but we're still months away from the general public being able to have the vaccine. We're shutting down our, economy yet again. And are the public policies there that we need them to be? And they're not. And, you look at paid leave as an example. And I have a 4-year-old and a 4-month-old. We've been in quarantine. My daughter had an exposure. And so I had to shut my whole schedule down. My husband had to shut his schedule down. We couldn't have any childcare, and we have privilege, right? So we were able to do that. But many families don't have that. But I understand what people are going through in terms of some of these challenges of juggling these issues. And when you look at an issue like childcare, so many people believe, this is my own personal problem to deal with. And I have to struggle to figure out how to make it all work. When actuality, it's not a personal problem. It's a policy failure that we haven't actually fixed this problem, and that we actually have public policies that can make people's lives better. And so those are the things I think we need to focus on. So as we come out of this economic recovery, I think it's incumbent upon people like me as a legislator and you all as thought partners to think about what is the bigger vision we want for our communities. Now is the time to be thinking about those bolder ideas in terms of what we do, and to be advocating at the federal level, to be advocating for this at the state level, in terms of really strengthening that social safety net and ensuring that our working families have the tools in the toolbox to be successful. Because I think, the COVID has demonstrated to us that we need to double down and rethink this. We need to figure out, what are our real priorities? How are we supporting working families? How are we making sure government is working for people? When you look at, unemployment, UI and EDD and some of the issues around there, you look at some of the testing backlog we've been faced with, there's a lot of challenges that we have as a state that we have to overcome, and we have to do better. And I say we as myself as well, as an elected official, we have to do better in leading on these issues and making sure that we're serving our constituents, because I believe that government can help people. That's why I ran for this job, and I think who you vote for matters. And I think COVID has demonstrated that now more than ever. And so it's incumbent upon folks like myself and you all as thought partners to lead a way to a bigger, bolder vision around how we can actually help working families. So I'm excited to be here with you all today. I'm excited for the conversation. I see a lot of good allies on the panel, and excited to work with you on the future to make a better California for our working class communities.
Thank you, Assemblymember Wicks, for those great remarks. We really appreciate your co-sponsorship and your team's work on these important issues for the state. Now I'm going to turn to our moderator for the program, Professor Will Dow. Will Dow is going to be the moderator for this briefing, and he's Professor of Health Policy and Management at UC Berkeley School of Public Health, and he also directs the Center on the Economics of Demography and Aging, or CEDA. Professor Dow's research analyzes the economic aspects of health behaviors and health and demographic outcomes, including work and family health, studies on health reform, paid leave, and other employment-related income and benefits policies. His honors include the Kenneth J. Arrow Award given by the International Health Economics Association. He is also a research associate with the National Bureau of Economic Research and previously served as a senior economist for health at the White House Council of Economic Advisors. Dr. Dow holds a PhD in economics from Yale University, and he's a champion for health equity at Berkeley and for the system. Thank you so much for moderating this panel, Professor Dow.
Thank you so much, Professor Rodriguez, and thank you for your leadership with the California Initiative for Health Equity in Action, which has been doing so much for the state of California in improving health equity and promoting policies that are helping out our working families here in the state. So as you introduced the panel, and as Assemblymember Wicks has stated so well, we have far too many families who are living in precarity. And the COVID-19 pandemic has highlighted this, but it's been a longstanding problem. And we're fortunate in California that we have had leadership on many policies which can improve the well-being of working families. As we know that children who grow up in poverty, they have lifelong negative impacts in terms of their child development, their well-being when they enter the workforce, and their health is negatively impacted throughout their lifespan. But we have been able to look at many policies which could improve these outcomes for kids and the families in which they live. So today we're very pleased to have 4 speakers with us, 2 of whom are researchers who have been working with a research hub that I have co-chaired that's sponsored by the Robert Wood Johnson Foundation, which is looking at policies such as minimum wages, earned income tax credits, paid family leave, et cetera, to look at the impacts of these policies. So we'll hear from 2 researchers telling us about some of the latest work on the benefits of these policies, what we've learned. And then we have 2 other speakers who have been very much in the trenches, working in advocacy and working in policy on how to implement these policies and make them more effective. So let's start with our first speaker today is Professor Michael Reich, who is a professor of economics and the chair of the Center on Wage and Employment Dynamics at the Institute for Research on Labor and Employment at the University of California, Berkeley. He served as director of this institute from 2004 to 2015. He has a PhD in economics from Harvard. His research covers many areas in labor economics, including economics of racial inequality, labor market segmentation, the historical changes in US labor markets and social structures, union management cooperation, living wages, minimum wages, and very recently related to the gig economy. So without further ado, let me turn it over to you, Professor Reich.
Thank you. Let me get my slides up here. Is that working?
Yes.
Yeah. Okay, great. Thanks for the introduction, Will. As Will mentioned, I've been working for quite some time on low-wage labor markets, and particularly on policies to improve low-wage labor markets, to raise wages, such as the minimum wage, earned income tax credit, and also the interaction between racial justice and economic justice. And finally, I've been working on the gig economy, the low pay of gig drivers, and I helped design policies for both New York City and Seattle that they have adopted for pay standards for gig drivers. I'll be happy to talk about that later. My talk today is somewhat a nerdy talk about how to do a study, how we've done a study together. I've done with Will and with Anna Godoy and Chris Lowenstein, which has just come out in the Journal of Health Economics. And the question we ask is, can labor market policies reduce deaths of despair? Deaths of despair means deaths from drugs like opiates, suicide, alcohol-related drugs. These have been going up in the United States, reducing actually white life expectancy. And the suicides, for example, went up about 33% in the last 20 years, and overdose deaths by over 250%. These increases are concentrated among Americans without a college degree. And so we look at all the work will be on those with high school or less. Possible, I'm kind of cutting off the bottom of are there possible economic solutions? I guess is the bottom of that slide. And in particular, we're looking at the effects of two policies in the United States, the minimum wage and the earned income tax credit. These are both policies that are especially advanced in California, which is set to go to a $15 minimum wage. And of course, some of our cities are already at or above $15. And we have an especially well-designed earned income tax credit we have had for the last 2 or 3 years. So there's a great deal of variation in each of these policies over time among the states. Some states, something like 21 states are still at the $7.25 minimum wage, and about 8 now are going up to $15 gradually over time. The method we use here, we want to do a causal analysis, not just a correlational analysis, is to study how mortality is affected when the states implement more generous policies, so these two particular policies. And we use something called an event study approach, which is not that complicated, but it's a fairly recent innovation in policy analysis. Basically, we're comparing outcomes in states that have had the policy changes to those that without the changes for several years before and after the events. And we stack up all the events. We have many events over say, the last 20 years. The data we have is from the CDC, and also, excuse me, we combine that with data from the current population survey, and we look at these 3 key outcomes: unintentional drug overdoses, intentional ones, and non-drug suicides. And here again, I'm just repeating what I already said, I think, about the event study approach with some more details about how one goes about that approach, which I will just skip over right now. And the basic, let's look at these sets of charts for a minute. Actually, let's focus on the one on the right, non-drug suicides. And the minus numbers below that. 0 is when the event takes place, the minimum wage increase. And in the years before that, here we have 4 or 5 years before, you see there's been no change in non-drug suicides. In the years after, there's quite a decline, and it's a persistent decline 4 years later. If you go to the middle chart, you'll also see some decline in drug suicides, but there was also some hints of a decline in the years before, which we call a pre-trend. And so that makes us a little doubtful that we're really picking up a causal effect. It might just be something else that was going on that's not related to the minimum wage or the ITC. And on the left, we have drugs that are not suicidal, unintentional deaths, overdoses. You can see there is not much of a trend before or after. So that was from the minimum wage. Similar results for the EITC, which I'll skip over going over them in detail, but they're basically the same, except the intensity of the effect is a little bigger in one than the other. I'll come back to that. Now, in order to make sure that this is a causal analysis, we have to exclude unobserved changes that might confound our causal analysis. So one way we do that is we first look at the effects for those who have a BA or more, and we find there are no effects among that group. So that means our method is not picking up general improvements, say, in mental health care over time, which one could, say is would be a threat to our causal analysis. And and then, of course, there are just other policies that might have come along that improved health outcomes anyway. But when we look at cancer mortality for our group that's exposed to low wages, those high school or less, we don't find any effects. So that is reassuring that what we're picking up is a causal analysis. Point estimates here, that just means the effect size. A higher minimum wage decreases non-drug suicides by about 3%, and a 10% higher earned income tax credit reduces those suicides by almost 5%. And then these effects line up, with how low wage each individual subgroup is, like for women, for example. We finally, to get another way of expressing the amount that these policies are reducing suicides, we do a simulation that looks at the effects of the state minimum wages that were introduced since 1999. There are quite a few now, not all up to 15. I think there are 29 states that have some minimum wage over and above $7.25. And we do a similar analysis with changes at the state level EITCs. And we find that together, these lead to about 10,400 fewer drug suicides, non-drug suicides, than would have occurred otherwise. That's a pretty large amount, especially if you start to quantify it in terms of what the value of a life is. If you believe you can quantify that, it comes out to many, many billions of dollars. So we conclude that there is no evidence that these policies can have effects on drug deaths. That's actually not so surprising, because the despair that's underlying them is probably long term, and these changes over short term, which is what we're looking at, just a couple of years, probably can't be that effective. But they are effective for non-drug suicides. Many people know that suicides are affected by economic conditions, for example, by the unemployment rate, and we're finding here that when you improve people's lives by raising their minimum wage or giving them a higher EITC, that there are fewer suicides. What are the lessons for the current moment that we're in, where we have a public health crisis as well as an economic crisis? I guess it's that we should be cautious. We need to be cautious because it's a different kind of moment from the one in our study. But it is the case that the initial response to COVID, the CARES Act included significant income support policies for laid off workers. And as excuse me, Buffy Wicks mentioned, these are about to expire. Our findings suggest those policies would have mitigated adverse mental health impacts. So we certainly hope they would be continued. Thank you.
Fabulous. Thank you so much, Professor Reich. I think this is incredibly timely, as we discussed, as Assembly Member Wicks discussed, in terms of the potential for federal policymaking at this time, and as well as additional state level action that could improve the economic supports for our working families in many different ways. So just to remind everyone, please enter any questions that you have into the Q&A feature of the webinar. And what we're going to do is go through all 4 of the presentations, and then we will take questions related to each of these. And I think one of the obvious questions is, what are the next steps around minimum wage policy that we might see in the next administration nationally, as well as what are the opportunities at state levels. So what we'd like to do now is switch to our second research presentation, and this one is also related to the Earned Income Tax Credit. So I'd like to introduce our second speaker, Professor Rita Hamad from the University of California at San Francisco. She's a social epidemiologist and a family physician in the Philip R. Lee Institute for Health Policy Studies and the Department of Family and Community Medicine at UCSF. And she's also the director of the Social Policies for Health Equity Research Program at UCSF. And her research focuses on the pathways linking poverty and education with health disparities across the life course. She is a fantastic researcher, and if any of you are interested, you might want to start following her on Twitter as well. She's an excellent contributor to public discussions in that forum. But today we're very pleased to have her presentation. So without further ado, Professor Hamad.
Thank you. Thanks for that great introduction. Let me pull up my slides here. And let me make sure you can see the right view. Okay, hopefully you guys can see that. So yeah, thanks Professor Dow for that introduction, and to the team at Cal IHEA for inviting me to give this presentation today. So you heard a little bit about the Earned Income Tax Credit from Professor Reich, and I'm going to be doing a little bit deeper dive into that to talk about the challenges and opportunities for this particular policy. So the EITC, for those who aren't familiar with it, is the largest poverty alleviation program for families with children in the U.S. It is dispersed as a lump sum tax refund every spring to low-income working families when they file their taxes. And in the most recent tax year, over 25 million households received an EITC refund, totaling over $60 billion annually. So the average benefit is about $2,500 per family. And on top of that, over half of states have added their own supplements to the federal EITC so that some families can get close to $10,000 in total. A lot of states started implementing their own EITCs in the 1980s. California was a little bit late to the game, starting in 2015, but at the moment, almost 1 in 5 state residents are EITC recipients. So these two figures show the size of the EITC refund for single filers on the left and then married filers on the right. And the x-axis at the bottom is filers' earned income, and the y-axis on the left is the size of the credit. The blue shaded area is the federal EITC, and the orange is the state EITC. And so for both, you can see that filers with 0 income get no EITC because it is contingent on employment, but that the refund size grows with increasing income up to a given plateau, and then it's phased out at higher incomes. So as you can see, the Cal EITC is actually targeted at even lower income filers than the federal EITC. And if you look at the y-axis, married filers' tax credits are about 10 times higher than single filers. So importantly, the vertical dotted line in each figure shows the required filing threshold. So in other words, those below the line aren't required to file taxes because their incomes are so low. And of course, if they don't file taxes, then they don't get the EITC. And there's concern that many of these people don't realize they're eligible, as I'll discuss a little bit later. So there have been several important recent changes to the state and federal EITC, in part due to COVID. So in California in 2019, Cal EITC was expanded to include individuals with slightly higher incomes than the figures I just showed. And earlier this year, it was expanded again to include undocumented filers. At the federal level, the HEROES Act was passed earlier this year by the House and included changes to the EITC, but it was not passed by the Senate and not supported by the White House. It would have expanded the EITC for workers without children who get very small refunds under the current formulas, and it would have allowed all workers to use either their 2019 or 2020 income to maximize their refunds. The latest stimulus proposal under discussion right now doesn't seem to have anything related to the EITC the last I checked, but it's an evolving situation, and certainly the incoming Biden administration could take this up. In terms of the evidence for the health effects of the EITC, it has not just the health effects, but the effects in general of the EITC. It has well-established impacts on poverty reduction, bringing millions of families out of poverty every year. And most studies also agree that it increases employment because it is contingent on working. And the health effects are somewhat mixed, but generally positive. For kids, studies have shown repeatedly that the EITC increases infant birth weight and also improves child development scores. For adults, the EITC has been shown to improve food security, and as we just heard from Professor Reich, improve mental health and to reduce smoking. Several studies have also shown that the benefits are even larger for Black mothers, suggesting that the EITC may be one policy tool to address racial disparities and wealth and health. And I think we've already had a question about that in the Q&A. And a handful of studies have shown mixed and perhaps negative effects for obesity and metabolic markers. So getting to the challenges, one of the main challenges that limits the positive impact of the EITC is low take-up. So only 70 to 80% of families who are eligible actually receive their EITC benefits. You'll remember from that earlier figure that the lowest income families aren't required to file taxes because they won't owe anything. So it's thought that their take-up is even lower than this. And the California legislature has historically provided funding for EITC outreach, but there's actually not clear evidence for any outreach programs being effective at enhancing take-up. So for example, the Franchise Tax Board, or FTB, partnered with the California Policy Lab at UC to test 6 different interventions among 1 million Californians. These interventions included both letters, text messages with different types of messages, for example, information on free tax filing, average benefit size, using formal and informal language, in multiple languages targeted to different groups, giving people links to websites or phone numbers. And the results were published earlier this year, and very disappointingly for many of us in the field, and sadly for many families, none of these different interventions were shown to increase take-up. And these challenges with take-up are probably even more amplified during COVID because of difficulty in accessing in-person tax support, maybe more limited outreach, and because policies are changing and people's eligibility is changing, and there's potentially low awareness among recipients. So unfortunately, there is really very limited evidence to understand why take-up is so low and why these interventions failed. So I'm actually an investigator on a study in partnership with collaborators at UC Berkeley, in which we're interviewing hundreds of low-income Californians to understand exactly this question. We've interviewed 100 families so far, and we actually reviewed their tax forms to verify whether they claim the EITC. And we've been surprised in this small sample that 44% so far have not received EITC benefits despite being eligible. And of those, 59% did not even file their taxes. So these results are very preliminary, and our next step is to analyze our qualitative data and other survey questions to better understand why we're seeing these patterns. So more to come. So with the evidence we have so far, there are a few policy recommendations to address this issue of low take-up. So based on the FTB CPL study, we've learned that targeted informational nudges cannot be the sole strategy. And it's also important to reduce the administrative burdens of tax filing for these families who already have limited time and resources. And finally, increasing the availability and quality of free tax preparation services is likely to help. But as we researchers are known to say, more studies are needed to understand whether such interventions are effective before scaling them up. A second potential challenge of the EITC is that it's distributed as a lump sum in the spring at tax time. So this figure shows the proportion of tax refunds received by month separately for EITC recipients, the dotted line, and all taxpayers, the solid line. On the x-axis are the months of the year, January, February, etc., and on the y-axis is the proportion of tax refund payments being made. So while many tax filers wait until later in the tax season to file, EITC recipients tend to file earlier, perhaps because they know they're about to get a large refund. What this means is that the EITC recipients have lumpy income, as economists call it, with potentially thousands of dollars received all at once at tax time, but then limited income in the rest of the year. And there's concern that this may lead to fluctuations in health or a feast or famine pattern. And indeed, a few studies have suggested fluctuations in food security and metabolic markers among adults, but no fluctuations in healthcare spending, while for children, we also see fluctuations in food security. In the past, filers did have the option of claiming the advanced EITC, as it was known, also known as periodic payments, which were distributed throughout the year. But this program had low take-up of just 3% of filers, and it's no longer widely available. Notably, it was found to reduce debt and financial stress and improve food security. And unfortunately, the limited evidence we have also suggests that it was logistically complicated for employers and workers to sign up. So it may be that during COVID, this is even more important as families have more volatile income with business closures and school closures, so that this issue is going to become even more important. To address this challenge, I have here a couple of policy recommendations. The first is to consider reinstating the periodic EITC payments throughout the year. And the second is to evaluate ways to do this without excessive administrative burdens for employers and workers. So you'll see a theme in what I've been saying. So I'll stop there, but I'm happy to take questions during the Q&A, or you're welcome to contact me later if you'd like to talk separately. Thank you.
That was fabulous. Thank you so much, Professor Hamad. There's a great deal of interest in the EITC, and as you'll see in the Q&A questions that have come in, we won't have time to answer all of those. So if you want to answer any live, feel free to do that. So we are going to pivot now to have two presentations related to paid leave. And so there are many types of paid leave that we can think about, paid family leave in general, paid sick leave, paid parental leave. And we've seen that particularly during COVID-19, the institution of a federal paid leave program, which was the first time that we had a systematic federal level program around paid leave. So there's been a great deal of activity, a great deal of leadership from California. And so our first speaker to talk about paid leave, we're very pleased to have with us Bridget Shea, who is Senior Campaign Manager with Paid Leave for the United States. This is a national campaign to win paid family and medical leave by 2022 is their goal. It's founded by Katie Bethel, who Fortune magazine named one of the world's greatest leaders. The organization, in partnership with employees, employers, consumers, and investors, has won paid family leave for nearly 6 million at companies like Walmart, Starbucks, CVS, and more. So thank you so much, Bridget. The floor is yours.
Thank you, and thank you for that introduction. I'll just get 1 second to get these slides up and going. All right. So thank you again. When I think about what is needed during COVID and beyond, I think, what comes to mind is that many of these economic supports were desperately needed by American families long before this pandemic, and will continue to be needed to address the economic and racial disparities after. So I'm going to be taking a closer look at the state of national play, touching on what we've learned from states from California and where we need to go. So, 113 million workers in the United States don't have access to a single day of paid leave. And when you go deeper into those numbers, the realities are more stark. 93% of low-wage workers, many of whom we depended on during this pandemic, don't have zero access to paid leave. So I want to take a moment to share a story here today that kind of gives voice to exactly what was at stake.
My mom had congenital heart disease. She knew she would die. I worked, and when I needed the leave the most, it wasn't there. So I had lots of difficult choices to make. Do I go with my mother to this surgery, or do I go on this trip for work? And I went on the trip. The hospital had been looking for me because my mom didn't wake up. It was my responsibility to be there, and I wasn't. No one should have to decide between their salary and their dying mom. It makes no sense that in this country, the workforce is not guaranteed the right to tend to their families. My mom had congenital heart disease.
So, the reality is that Yakima isn't alone. Even before the pandemic, American families were struggling. 1 in 4 Americans returned to work within 2 weeks of giving birth. Low wages are a leading cause of medical bankruptcy, and 1 in 7 people have lost a job due to taking unpaid leave. So the thing about this as well is paid leave and has had momentum in the private sector that shows no signs of slowing, but only for some. So in 2019, we conducted an employer trends report and surveyed 62 private companies. And what we found was that 13 were offering new and expanded policies benefiting 2.4 million workers, which is great. But the divide around race, ethnicity, and gender were more pronounced. Sectors where women were the dominant workforce, like health and education, tended to have the least access to paid leave. People of color, over a quarter of the workforce in transportation and utilities, were 2 sectors that offer the least amount of paid leave. And that's only a traditional look at the workforce. So, when you think about things like the growing gig economy, 2 years ago was projected to be 36% of US workers in the gig economy, which is roughly 57 million people. And that's only been projected to grow. Yet these are the jobs that offer the least amount of support. And what we're also seeing is that large corporations, ones that you would typically be able to expect to hire traditional employees, are more and more often going to third-party services. I think of Target as an example using Shipt delivery. And although they may offer some of these benefits to some of their employees, they do not offer it to these gig workers. So again, I just want to call out that these sectors that I've highlighted represent essential workers that we've relied on during the pandemic, people who are taking care of our children, our loved ones, and keep our economy running. But they've already had the least amount of support available even before the pandemic. And as more data continues to come out regarding the communities that suffered the greatest impact of the virus, I think we'll continue to see that it underlines that these are the same communities that already had the least access to paid family and medical leave. So, we've talked about a little bit about how this was an issue beforehand and that the pandemic really just exacerbated it. So what can we take away? The Urban Institute did an early study in California and Rhode Island that showed that states that already offered paid leave were able to quickly pivot during the pandemic to support folks, even before the Family First Coronavirus Response Act passed, and people were able to use paid leave as a qualifying event. And we know that women in particular, I know Assemblymember Wicks mentioned it, are shouldering a large caregiving burden and are leaving the workforce. Today, there are nearly 2.6 million fewer women who are in the workforce or looking for work than in November of last year. Women's unemployment is at 6.1%, and that is more stark when you're looking at Black women and Latino women, and they're going to continue to need policies like paid leave in order to recover economically from this pandemic. And what we know now is that with the sunsetting of the FFCRA at the end of the month, despite rising coronavirus cases, in the short term, we know that paid leave is needed to be extended in order to really help these families out. So, paid family and medical leave, what that means is this is an opportunity to transform America with a one-time investment in healthy, thriving families. 113 million people gain immediate support for paid leave, and there's $500 billion added annually to the US economy due to increased women's labor workforce. So when we're thinking about what a high quality program looks like, we know that people need a sufficient amount of time in order to take care of their family, whether it's welcoming a new child or being there to support an ill family member. It needs to be 100% paid for the lowest wage working families. So people are not having to choose between taking care of a loved one or making rent. And it needs to include parental caregiving and personal leave, and really reflect like the everyday needs of our families and our workforces. And it needs to include all worker types, including those in the gig economy. And, much like California, and we're going to hear more about it, a social insurance model is what we've seen work here in California. Thank you.
Thank you so much, Bridget. There's so much opportunity for improving access to paid family and medical leave in the US. So I hope we can get to this in the discussion. There's some more ways about how we might move this policy agenda forward. So let's pivot now to our fourth speaker, and then we will turn to the Q&A. So our fourth speaker is Jenna Gary, who is a senior staff attorney at Legal Aid at Work. As an attorney in their work and family program, she focuses on the employment rights of pregnant women, new parents, caregivers, and survivors of domestic violence and sexual assault. She provides direct representation, participates in legislative advocacy to expand family-friendly workplace policies, and engages in community education. She also helps direct the Healthy Mothers Workplace Coalition and the Medical Legal Partnership with the Women's Clinic at Zuckerberg's San Francisco General Hospital. And I've had the pleasure of working with Jenna on a number of issues related to paid parental leave. I always enjoy her wisdom and insight in working with her. So thank you so much for being with us, Jenna.
Thanks so much, Will, for having me. So you can see my slides now?
Yes, thank you.
Great. So as Will said, I'm Jenna Gary, and I'm with Legal Aid at Work, and we're a nonprofit that advocates for the rights of low-wage workers. We're based in San Francisco, but we actually cover the whole state of California. I specifically work in our work and family program, which Will said focuses on the rights of pregnant workers, new parents, caregivers, and people dealing with their own medical crisis. Our work involves direct representation. We have a helpline where we hear from thousands of workers across the state each year. We provide direct services, we do some litigation work, and then we also do work to expand policies on the local, state level mostly. So Bridget really touched on what is happening, and I think gave a good overview of basically before COVID-19 hit, we were in a caregiving crisis in the United States. We know, and we've heard from, I think, several presenters today, that research shows that paid leave has tremendous benefits for families' health, well-being, and economic security. But before the pandemic, the US stood nearly alone in the world in having no federal paid leave policies. And this chart I just wanted to highlight shows what paid leave policies look like across the world. And you'll see the US stands out in that we do not offer or mandate any universal paid leave. And this lack of paid leave, as Bridget pointed out, is especially harmful for workers with low wages, which also are disproportionately workers of color who rely on every paycheck to make ends meet, and therefore are more likely to go to work sick for fear of losing the income they need to support their families. And of course, COVID-19 just made this all worse. So I'm going to go into detail a little more of where we are in California, because we really have been a leader on this, but how far behind we are with the rest of the world, and really some ideas of how we can make sure that our paid leave policies here in California remain at the cutting edge and really work for all working families in California. So the first thing is paid sick leave. So here in California, we're extremely lucky in that we actually have a state law that mandates 3 paid sick days for all employees that can be used whether they're dealing with their own health conditions or caring for a family member dealing with health conditions. And then when the COVID-19 crisis hit, we've heard the federal government responded by passing the Families First Coronavirus Response Act, which provided emergency paid leave related to COVID-19. However, that there was huge gaps and exclusions. One of the biggest ones is that it excluded anyone who worked for an employer with 500 or more employees. It also excluded certain emergency responders or people that worked in the healthcare sector, and non-employees. So kind of these gig economy workers were also excluded. So through executive order and then later through legislative action, the state of California did pass some emergency paid leave, some extension of that. So right now, workers have at least up to 10 days, and this includes food sector workers, which covers a little bit of those gig economy workers, and includes people who work for those larger companies who may be excluded from the federal protections. Unfortunately, all of this, as we've heard, is set to expire at the end of this year. So come January 1st, 2021, in the height of this pandemic, so many Californians are going to find themselves without a single day or access to any paid sick days if they get COVID or a family member does and they need to take time off. Additionally, our state expansions didn't include the right to use that leave to care for children or other family members due to school or care closures. So that's, a huge issue. And then just finally, beyond COVID, 3 days simply isn't enough, 3 days per year, particularly when we're talking about in the middle of a public health crisis where the public health departments are, saying people should quarantine for at least 2 weeks, even if there's a possible exposure. So beyond just making sure we expanded for emergency situations, California needs to go beyond 3 days. And many local jurisdictions within California have already done this and have been really successful with it. The next big bucket beyond paid sick days is family and medical leave. So here in California, again, we were a leader in that we passed the first in the nation paid family leave program. So the way it works here in California is we have a set of laws that allow people the right to get wage replacement benefits if they're off of work because they themselves are sick, they're caring for a seriously ill family member, or they are bonding with a new child. And these are just wage replacement benefits. And then we have a separate set of laws that actually give people the right to take the time off work during these instances, knowing they have a job to come back to. So like I said, California, a leader in this area. In 2004, our paid family leave program went into effect. And so here in California, nearly all employees have the right to wage replacement benefits if they're off work due to their own disability, if they're caring for a seriously ill family member, or bonding with a new baby. You get 52 weeks for your own disability and 8 weeks for bonding or caregiving for a family member. And those are paid at 60 or 70% of your normal weekly wages. And as Bridget said, here in California, ours is a social insurance program, but it's entirely funded by employees. Employers do not pay into this program at all. And then the job protection piece. So here in California, eligible employees have up to 12 weeks of unpaid but job protected time off to bond with a new child, care for their own serious health condition or a family member with a serious health condition. But like the federal law that covers the same area, there's 3 high eligibility requirements that leaves out about 40% of the workforce. So 40% have no access to these 12 weeks. And that is you've had to be with your employer for 1 year, you've had to work 1,250 hours in the year prior to your leave, and your employer has to have a certain number of employees. So I have an asterisk there. We had a really big victory in California this past year that expanded the right to take this job protected leave, particularly to low-wage workers who disproportionately work for smaller employers. So low-wage workers and workers of color tend to work for smaller employers, and therefore were more excluded from these rights than their higher-wage white earners. So under this new law that's set to go into effect January 1st, the employee threshold to qualify is going to go down to 5 employees, and this is going to cover up to 6 million more Californians. And we're very excited about that. But again, gaps remain, right? So even though now 6 million more workers are going to have access to this right to take time off because of employer size, they still are going to face these tenure and hours requirements. And because so much of the workforce has been laid off during this COVID-19 pandemic and will be starting new jobs, many will not meet those requirements. So that's part-time workers, people that are new to a job. They're not going to have access to this job protected time off. So anytime they take off to care for themselves or a family member, they're risking their job. And from the callers I talked to many times, they can't do that and they will just choose to go to work. Another big one is insufficient wage replacement rate. We know low-wage workers are barely making it on full wages. And so when you're only providing a 60% wage replacement or even 70, that's simply not enough. And we see in the data that low-wage workers have a much lower take-up and length of taking paid family leave benefits because of this. We also in California, our wage replacement benefit rate actually used to be 55%, and based on legislation a couple of years ago, it got raised to the 60 or 70, but that's also set to, it's due to sunset at the end of 2021, which means if we do nothing, it will go back down to 55%. So some proposed policies is we really need to make sure that all workers, regardless of length of time, tenure, size of employer, have the right to take this time knowing they have a job to go back to. We need to make sure that there's a high enough wage replacement rate so low wage workers can actually use these benefits they're paying for. But we also got to consider the funding and make sure that these expansions of the program are not borne entirely by employees who simply cannot afford higher taxes right now. And that we must, as Bridget pointed out, make sure that these policies support caregiving across the spectrum and that it's not just parents. Oh, and then the last policy I just want to touch on that isn't a paid leave, but is really important. I think Assemblymember Wicks pointed out that in September, and we've seen this across the news, that women are leaving the workforce in droves, millions of women, because they can't juggle their caregiving responsibilities with their work life. And that's because right now there's insufficient protections or affirmative rights for workers to deal with their family responsibilities. And so California really could be a leader in this area in ensuring that workers have the right to flexible schedules and other accommodations they need to make sure they can deal with this remote learning, school and childcare closures. And then finally, and I think this was touched on the EITC, but I think it's so essential, particularly when we're talking about supports for low-wage workers. But all these laws are great, but they only work if people know about them and can have access to them. And so you have to have effective outreach and education. And so on this slide, you'll see some of our materials we've created, because as you can see, it's super complex. There's about 5 different laws that might apply to you when you need to take time off. And they all have different eligibility requirements. So here you'll see COVID-19 in my job and COVID-19 caregiving in my job materials we created. And we think it's really essential that these materials be distributed by trusted messengers and key points. So anyone who's giving tested for COVID-19, when you're doing contact tracing, make sure you're providing these workplace rights information in multiple languages. So people know that if they have COVID-19, they actually have the right to stay home and get paid and keep their jobs. And I know we're running out of time, so I will hand it back.
Oh, fabulous. Thank you so much, Jenna. So much good information there. And related to that very last point, I know that we've been having discussions about the potential for navigators who might be able to help people better understand their benefits, which I think would be a really exciting innovation. And I do want to point folks to the Q&A again. I know that a number of the questions have been answered. So for example, Professor Hamad has noted in response to a question that state EITC policies have been shown to be cost effective as a health policy investment. And we've seen similar research related to paid family leave, that paid family leave has really important effects on health outcomes. And I guess a question for Bridget and Jenna, first sticking with the paid family leave, what are the barriers to further policy innovation in California around paid family leave? And to what extent will it be important to work with some of the folks who haven't traditionally been allies on this work, such as the Chamber of Commerce, et cetera, in order to continue to expand some of the policy making in this realm?
Yeah, thanks, Will. So I think for a long time, there's been this, I think not just in the paid family leave world, but this idea that it's like employer versus employee, right? And there's like this power struggle. And I think we need to overcome that and realize that both don't function without each other, and that policies actually, paid family leave policies actually benefit the employer too. And we've seen all these studies that show that it increases retention, productivity. And so I think that narrative actually has started to catch on, and we're starting to see business groups, progressive business groups, actually want to partake and promote paid family leave. And so here in California, you know, the governor had a paid family leave task force that he convened last year that actually included business representatives. So it had the small business majority, it had Bay Area Council, and Unite LA, and they signed on to these recommendations. And it was really a productive conversation because it didn't start from, we need to maintain the status quo. It started from, the system is broken and we understand this is good for our employees, but here are the complications that we have. So you saw in the governor's task force recommendations, it not only included expanding paid family leave and job protection, but supports for small businesses. So there was a proposal to have grants for small businesses to apply for if they need to hire temporary staff to cover when their members are out. So I think it's that. I think it's a reframing of the issue and thinking about how do we make sure there's policies that benefit both of us. And I think we're seeing that, and we're seeing it on the national level as well.
Great, thank you. Bridget, did you want to add anything there, or?
You know, actually, I think Jenna just said it just so well. We are also seeing like growing national interest in doing this, and we're seeing it at the state level. You know, what comes to mind is Colorado, which just had, you know, an amazing victory where voters overwhelmingly said, like, this is important to us. And those are the type of things that continue the momentum for the national policy.
Great, thank you. Let me ask another question, and particularly ask Professors Reich and Hamad to weigh in. And I see Professor Hamad has already partly answered it in the chat. So this question asks, what policies can improve economic conditions for Latina and African American women, since these groups have had the largest sustained unemployment losses this year? So Professor Hamad, you noted that some of the research on EITC suggests that has very positive impacts, but what are the most important things that could be done, particularly to target, you know, this vulnerable group?
Well, I can start. The most important thing is to lower the unemployment rate overall, which requires having a national recovery program, economic recovery program, and that will disproportionately benefit those who've been most hurt, who are women, and particularly Black and Latina women. Raising the minimum wage federally at the federal level to $15 would also have a huge impact, again, because women, Latina women, Black women are the lowest paid, so raising the rate will increase their pay. And we have seen this in a couple of recent studies, including what I'm doing, that shows that minimum wages are an excellent means to reduce racial wage gaps for those who do have jobs.
Yeah, I would add, so the policies that Professor Reich mentioned would benefit those who are employed. I'd say to help those who are unemployed and who can't even access the minimum wage. A lot of these other policies that we've been talking about, like paid leave, would be great so that people don't have to quit their jobs or be fired if they have to stay home and take care of family members. They can just take amount of paid leave and stay at work. This is not discussed in this panel, but childcare, particularly during COVID, a lot of women are either cutting back hours or losing their jobs because they have to stay home when schools are closing intermittently or childcare is not available. So I think there's, like a network of policies that can be helpful in these situations to reduce these inequitable racial disparities.
Great, thank you. And I wish we had another hour to further discuss all of these great questions and so many important policies. It is the 1 o'clock hour, so to respect everyone's time, I want to thank all of the speakers, all of the people behind the scenes who set this up, particularly Camille Cooley and Denzel Tung. And thank all of you for being here. This is such an important set of topics, particularly at this moment in time. There's a great deal of energy around these topics in California right now. Here at Berkeley and at our sister campuses at UCSF and elsewhere, there's much research which is very action-oriented, which is ongoing right now. So feel free to reach out to any of us if you have further questions about this. And feel free to reach out to the advocacy organizations as well, who are doing some great work. So with that, I will close the session. And once again, thank you everyone for being here.